Have you ever noticed something off about your body? A strange pain, a new symptom, or an unusual feeling, and thought, probably nothing? It's easy to brush off these signs, but what if ignoring them could lead to serious health issues? In today's video, we're counting down the 20 health signs you should never ignore, from subtle changes that could be easily overlooked to critical symptoms that require immediate attention. Each one of these signs is a message from your body. Understanding them could be the difference between catching a condition early and facing severe consequences. Make sure to watch until the end, because the number one sign will shock you. Something almost no one talks about. Yet it could be the most important clue your body gives you. Hey everyone, welcome back to the channel. If you're new here, I'm your name, and I'm dedicated to helping you understand and take control of your health. Today, we're going to go through 20 essential health signs that you should never ignore. These signs are important indicators across a range of health issues, minor ailments to serious conditions. By the end of this video, you'll have a clear understanding of what to look out for and why it's crucial to take action if you notice any of these signs. Sign 20. Persistent dizziness or lightheadedness. Feeling dizzy or lightheaded on a regular basis isn't just an inconvenience. It could be a sign of low blood pressure, heart issues, or neurological disorders. If this happens frequently, especially if it's paired with fainting or chest pain, seek medical attention to rule out any serious conditions. Sign 19. Persistent body scratching. If you find yourself constantly scratching without any clear cause, it could be more than just dry skin. Persistent itching can be a sign of skin conditions like eczema or psoriasis, liver disease, or even kidney problems. It's important to get this symptom checked out, especially if it's accompanied by rashes or other skin changes. Sign 18. Difficulty swallowing. Struggling to swallow food or liquids might indicate a condition like acid reflux, esophageal cancer, or a neurological problem. This symptom can lead to severe complications, such as malnutrition or dehydration, so it's vital to get it checked out promptly. Sign 17. Numbness or tingling. Experiencing numbness or a tingling sensation, particularly in your hands, feet, or other extremities, could be a warning sign of nerve damage, diabetes, multiple sclerosis, or other neurological disorders. Early detection is key in managing these conditions effectively. Sign 16. Yellow eyes or skin, jaundice. If you notice a yellowish tint to your skin or the whites of your eyes, this could be a sign of jaundice, which often indicates liver problems like hepatitis, cirrhosis, or bile duct obstruction. Jaundice should never be ignored, as it can signal serious underlying health issues. Sign 15. Vision changes. Sudden changes in vision, like blurring, double vision, or partial loss of sight, should never be ignored. These symptoms can indicate serious health issues such as diabetes, hypertension, or even a stroke, and immediate medical attention is necessary. Sign 14. Skin changes. Your skin can reflect your overall health. Pay attention to any new moles, changes in existing moles, or unusual skin changes like darkening, thickening, or yellowing. These could be signs of skin cancer, liver issues, or other health problems. Sign 13. Persistent cough. Cough that won't go away after 3 weeks or more can be a sign of respiratory infections, chronic bronchitis, or lung cancer. If your cough is getting worse, or if you're coughing up blood, it's time to see a doctor. Sign 12. Unexplained bruising. You notice that you're bruising easily or find bruises without any apparent cause. This could be a sign of blood disorders, liver disease, or a vitamin deficiency. Don't ignore unexplained bruises, especially if you're experiencing other symptoms like fatigue or bleeding. Sign 11. Persistent headache. Frequent or severe headaches could be more than just stress or dehydration. They can be signs of migraines, high blood pressure, or even a brain tumor. If your headaches are getting worse or are accompanied by other symptoms like vision changes or nausea, seek medical advice. Sign 10. Changes in bowel habits. Sudden and persistent changes in your bowel movements, whether it's diarrhea, constipation, or the presence of blood in your stool, can be symptoms of digestive disorders like irritable bowel syndrome, IBS, or colon cancer. It's important to monitor these changes and consult a healthcare provider if they persist. Sign 9. Shortness of breath. Feeling short of breath after minimal exertion or even while resting could be a sign of lung conditions like asthma or chronic obstructive pulmonary disease, COPD, or heart problems. Difficulty breathing is your body's way of telling you that something isn't right, so don't ignore it. Sign 8. Chest pain or discomfort. Chest pain is one of the most alarming signs on this list, and for good reason. It could be an indicator of a heart attack or other serious heart conditions. Do you experience chest pain, particularly if it's accompanied by symptoms like shortness of breath, nausea, or sweating? Seek emergency medical attention immediately. Sign 7. Unexplained weight loss. Losing weight without trying might seem like a dream come true. It could be a warning sign of serious health conditions like diabetes, hyperthyroidism, or cancer. If you've lost more than 5% of your body weight in a short time without making any changes to your diet or exercise routine, it's time to see a doctor. Sign 6. Persistent fatigue. We all feel tired from time to time, but if you're constantly exhausted despite getting enough rest, it could be a sign of underlying health issues such as anemia, thyroid problems, or even heart disease. Persistent fatigue is a red flag that your body needs attention. Sign 5. Dry skin. While dry skin can often be attributed to environmental factors, it can also be a sign of dehydration, thyroid issues, or even diabetes. If your skin is constantly dry and flaky, despite using moisturizers and drinking enough water, it's time to get it checked out. Sign 4. Persistent indigestion or bloating. Occasional indigestion or bloating is normal, but when it becomes persistent, could signal gastrointestinal issues, such as ulcers, gallbladder disease, or even ovarian cancer. Pay attention to these symptoms, especially if they're accompanied by weight loss or changes in appetite. Sign 3. Persistent hoarseness or sore throat. If you're dealing with a hoarse voice or sore throat that doesn't go away after a couple of weeks, it could be more than just a cold. These symptoms can be early signs of throat cancer or other serious conditions, especially if you're a smoker or have frequent acid reflux. Sign 2. Sudden intense pain. Sudden sharp pain in areas like your abdomen, chest, or head can indicate serious conditions such as appendicitis, heart attack, or aneurysm. If you experience intense pain that comes on suddenly and doesn't subside, the medical emergency. Don't wait, seek help immediately. Sign 1. Bad breath that won't go away. Now here's the shocking sign you might not expect. Persistent bad breath. While bad breath is usually associated with poor dental hygiene, when it sticks around despite brushing and flossing, could indicate something more serious. Chronic bad breath can be a sign of gum disease, respiratory infections, acid reflux, or even kidney or liver problems. It's one of those symptoms that often gets overlooked or dismissed, but it can be a crucial clue that something isn't right with your internal health. If you're dealing with persistent bad breath, it's important to consult with a healthcare professional to uncover the underlying cause. Conclusion. The key message from today's video is simple. Your body knows when something is wrong, and it's your job to listen. These 20 health signs are warning signals that you should never ignore. Early detection and intervention can make all the difference in preventing a minor issue from becoming a major health crisis. Thanks for watching, and if you found this video helpful, please like, subscribe, and hit the notification bell to stay informed about how to take the best care of your health. Remember, your health is your most valuable asset. Take care of it. See you in the next video.